Thank you very much at magandang araw mga kaibigan. Nagbabalik po ang inyong programang Aksyon Central Luzon Special Edition. Ito po si Sunny Lopez. At meron po kaming ginagawa sa radyo ngayon because we have an understanding with the Angeles Medical Society that we will have an hour for at least per week po, no, pangkalusugan. And this is very beneficial po sa ating mga listeners at saka sa ating mga viewers, no? Kaya po, ang ating po naging point person at ngayon po yung co-host na natin, pag-uusapan po kasi natin ngayon, no, tungkol po sa kalusugan sa puso, no? Pero meron po tayong kasama sa aking pong kanan, no? Ang Vice President po ng Angeles City Medical Society, si Dr. Rowena Medina Mangubat. Ma'am, welcome to the show.
Hello, good evening.
Pwedeng good morning, pwedeng good evening, pwedeng good afternoon.
Good evening. Good evening to the televiewers of ACL Special Edition.
Yes. OB, ma'am. Si ma'am, OB, no? Pero kasi kailangan pag doktor yung makausap mo, dahil sa nila point person, meron po tayong katulong. Dahil ako po hindi naman doktor, no? Pero as I've said, our specific topic for today is about pangkalusugan po sa puso, mga kaibigan. Nandito po ang head ng Coronary Care Unit, Internal Medicine, and sa Adult Cardiology, si Dr. Elaine Payumo. Ma'am, welcome to the show.
Hello, good evening po sa ating mga televiewers and welcome po sa ating show for tonight.
Okay. And to the left of Dr. Payumo is the section head ng Cardiac Rehabilitation ng Internal Medicine, also for Adult Cardiology, si Dr. Melissa Frigiliana.
Good evening to all the televiewers of Action Central Luzon Special Edition. Good evening, Sir Sunny.
Hey, good evening and welcome. Ako,
Thank you.
Very exciting po to. Stay there. The first time I've met them, I've asked them, because of this perception, sometimes nag-i-interchange po yung stroke at saka yung heart attack, no? Ano bang kaibahan yan? Pareho ba yan? O, kasi pag iba na-atake sa puso, na-stroke, sabi nila eh. What's the real story there?
Actually, both of them po have the same pathophysiology or ibig sabihin reason, which is merong bumabarang ugat. Now, if you say heart attack, yung bumabarang ugat na yun ay nasa puso. Okay. Ngayon, kung stroke naman po, yung bumabarang ugat is nasa brain. So, yun po yung difference between the two.
Sa Pilipinas po ba, talagang dumadami yung mga incidences ng heart attack at saka po ng mga stroke, ma'am?
Yes, actually, not just in the Philippines, but also in the world, the leading cause of death is still cardiovascular diseases, which is, yun nga po, yung stroke and heart attack.
Why is this so, Dr. Frigiliana? Why is this happening? Especially nowadays, we always hear people talking about pati bata, di ba?
Yes, opo. Totoo yan. Recently, mas maraming bata na rin ang na-atake sa puso. Basically because yung lifestyle natin. Pangalawa, family history. Pwedeng merong mga sakit sa puso sa family. And then, yun nga yung diet and smoking. All adds up to the risk of having a heart problem or heart attack.
Meron na rin mga bata, di ba, ma'am?
Yes, opo.
Lifestyle. Kasi ang
Yeah,
lifestyle ng
lifestyle,
mga bata ngayon, iba kasi, di ba, Doktora? So,
Yes.
Aside from these people, the young and the old, ano ba yung dapat nilang maramdaman or makita sa kapatid, kamag-anak, nanay or tatay na pwede silang masabi na kailangan pumunta na sila sa doktor na cardiologist para magpatingin na kailangan na nilang magpatingin?
First, ayun. Sige, si Dr. Payumo naman.
Kasi iba nagbabawak lang eh.
Oo.
Wala to.
Actually, yung most common symptom or symptoms of heart attack is still chest pain. Siyempre puso, chest pain. So ito is, you can describe it as chest heaviness. So during, let's say, exertion or during the times na napapagod yung mga tao, or during emotional outbursts like sobrang tuwa, sobrang galit, sobrang lungkot, yun yung characteristic ng chest pain. And usually, it can radiate to the left jaw or to the left shoulder. Then aside from the chest pain, there could be mga simptomas na nagkakaroon ng hirap huminga or difficulty of breathing, madaling mapagod, easy fatigability, and then mga simptomas ng pagpalya ng puso like pag humihiga, kailangan mataas yung unan na parang nalulunod or parang kinakapos ang hininga. So, yun yung mga simptomas ng may sakit sa puso or heart attack.
Anong klase yung sabi mo, heaviness?
Heaviness, parang merong nakapatong dito sa
Parang may
dibdib,
nakadagan.
parang may
Nakadagan,
nakadagan.
heaviness talagang.
Oo.
Yes.
Kasi
Sa chest
important-
yan.
Yes, sa chest. Kasi importante yan, lalo na yung mga televiewers natin. Baka may sumakit lang sa kanila sa dibdib, sabi nila, inaatake na ako sa
Oo.
puso.
So, paano nila ma-differentiate
Kailangan-
yung like the heaviness, the feeling of heaviness? So, dapat ba parang nawawala siya? Or anong difference niya dun sa merong parang muscle pain lang na chest pain? Parang ganun.
So, ang importante is ma-distinguish at saka ma-recognize ng ating tao yung chest pain na nagmumula sa delikadong parte ng katawan, which is the heart, at saka yung hindi naman delikado, which is from the muscle. So, unang-una, sinabi ng Dr. Payumo, chest heaviness, yung parang may nakadagan na may umiipit sa dibdib, usually dito yan sa may gitna, sa bandang kaliwa, na nagra-radiate sa kaliwang balikat, kaliwang kamay. Tapos, may kasamang hirap ng paghinga, yung sinasabi nilang dyspnea, tsaka shortness of breath. Minsan, may pagpapawis ng kamay, at saka yung...
Sweating? Heavy ba yung sweating?
Sweating, yes. At saka may
Cold
hirap ng
sweat.
paghinga, yes.
Eh, yung gamot na iinumin, should they take a medicine before
Immediately.
going to the doctor? Or
Yes. Aside from that, dun sa na-mention ko, yung chest pain naman na sinasabi na muscle pain,
Oo.
yan kasi hindi naman delikado. Kailangan ma-recognize din nila yun. Yung chest pain na galing doon, yung para lang pag gumalaw ka, medyo masakit, bigla, sudden, tapos suddenly nawawala din.
Yung positional, hindi
Yes,
positional yan.
positional.
Pag heart attack, kahit anong
Kahit
position
anong
mo,
posisyon,
merong heaviness yan,
heaviness
merong
yan.
pain.
Yes, opo. Hindi kagaya sa muscle, talagang pag diniinan mo sa tapat dyan, masakit. Pag it's coming from the heart, kahit hindi mo dinidiinan, may sensation ng mabigat. Yes, pain.
O yung tusok-tusok lang, ganyan, parang merong tumutusok-tusok. Ibang klase yun.
Usually,
Kulang ba
hindi,
yun o ano?
usually hindi yun from the heart, kung tusok-tusok lang siya. Pwedeng sa muscle or yung ugat or nerve, yun yung mga possible causes kung tinutusok-tusok. Pero ang term talaga or keyword is heaviness.
Heaviness.
May mabigat na nakadagan. And aside from yung mga precipitating factors, ibig sabihin during emotional stress or napapagod, activity, dun siya sumusumpong at pag nag-rest yung pasyente, nawawala yung chest pain. Also, yung timing. So if, let's say, mga 5 minutes, a few seconds lang siya, usually you can observe lang muna yun, hindi yun delikado. But if it lasts for several minutes, let's say 15 minutes, hindi nawawala. Kahit
Inconsistent yung pain. Consistent.
kahit huminga ka, kahit uminom ka ng tubig, or magpahinga, nandun pa rin yung pain, yun yung, it is compatible with the heart attack.
Let me ask you, this is something very common, no? Kung iba, hindi naman na-atake. Pero dahil sa ninervyos sila, meron silang naramdaman, kaya nyo siguro dinidiscuss ngayon yan.
Yes.
Pwede bang mag-lead sa heart attack? Yung sa nervyos nila, dahil ano ko, merong sakit yung dibdib ko. Is that a possibility?
Yes, actually, yung nervyos is a form of stress, di ba? And aside from the risk factors na sinabi ni Doktora, mga precipitating factors for leading to heart attack, stress is also one major precipitating factor. That's why, because of our lifestyle now, especially yung mga young individuals, very stressed yung lifestyle nila, marami na tayong mga bata na in their 30s, pero nagkakaroon na sila
Or
ng heart
below
attack.
30s.
Or even below 30s, late 20s.
I just want to add also to that, iba yung panic attack kasi. Yung panic attack will also last long, mga 20 to 30 minutes. May kasama din yung paninikip ng dibdib,
Oo.
may kasama din yung hirap ng paghinga. But the difference is, yun, it can occur even at rest, hindi siya precipitated by an activity, and there are no other associated signs and symptoms. Wala yung nakikita mo pinagpapawisan.
Pero sabi niyo may precipitating activities, but some of the studies that I have read, researches, 10 o'clock daw in the morning, madalas na magkakaroon ng yung pagkatake sa puso. Yun yan, katatapos mo lang matulog niyan, di ba?
Yes, it's very common in the morning. Actually, more common in the morning. Yun kasi, kung may mga risk factors din sila.
Okay.
Like, halimbawa, obese, or may mga diabetes,
Ayun.
hypertension, na poorly controlled. Tapos yung lifestyle, sedentary, yung palang pagkakatulog niya, kahapon pa, mga ganyan. Then no activities the whole day. And then, yung diet.
So, Okay.
Although, I just want to add po,
Oh.
although sinabi ninyo na tama po yun, in the early morning, nagkakaroon ng mga heart attack or stroke, even though the patient is asleep or at rest during those periods, but the time that the patient wakes up, bigla siyang gumising. Yun na nagkakaroon ng mga different hormones or changes dun sa katawan.
Yeah, okay.
Yung example is the hormone na catecholamine. Yun yung nagtitrigger kung bakit mas common siya in the morning.
Yeah, pala.
So aside from syempre napag-usapan natin yung what should they feel or ano yung mga signs and symptoms na dapat pupunta sa doktor. Pero pwede din ba silang pumunta sa doktor na hindi naman sila, wala silang nararamdaman.
Oo.
For just some reasons na
Check up.
gusto lang nilang manigurado na they're okay. So what should they do?
Oo.
Are there procedures that they can do? At what age should they go to the doctor to have these procedures done?
Yes, at AUF, actually, we have this wellness program
Okay.
that they can have the screening. So for this kind of diseases, we start with of course, the blood examination, check for the cholesterol, check for the sugar, which are risk factors talaga for developing atherosclerosis, and then basic ECG, then the 2D echo, and then stress test. Those are ancillary procedures that nire-request namin sa mga pasyente, depende dun sa sintomas nila upon presentation. Ngayon, kung halimbawa screening lang talaga, yung basic na ginagawa natin is check for the sugar, and then check for the cholesterol, and then the ECG and 2D echo.
Yun ang mga factors na pagdelikado yan, di ba?
Opo, opo.
Malalaman mo lang yan pag sa blood test.
Yes, sa blood test.
Kahit wala kang nararamdaman.
Kahit wala kang nararamdaman, kasi basically, ang
So
diabetes,
anong age nyo gusto
Oo.
sila na pumunta?
Ideal.
Me as a surgeon, we know for a fact tayo na before we do a procedure, before a patient undergoes a procedure, a surgery, we do a CP clearance. It's a cardiopulmonary clearance. So our cut-off age is around 35. And then they should, before that age, pwedeng walang clearance eh.
Yes.
But after that age, di ba,
You
so
should have.
nagpapa-clearance tayo. Yun yung mga sinabi niya na pinapagawa natin. Kaya yung iba pong mga pasyente, nalalaman lang nila na meron silang sakit sa puso, na meron silang problema sa diabetes. Minsan pag magpapagawa lang ng
Clearance.
operasyon, so they will undergo a certain procedure, dun lang nakikita. So even them, di ba, dapat pagka maoperahan sila, kailangan sila rin mismo they should talk it with their doctor that they should undergo clearance. Pero yung iba, kahit hindi naman ganong age,
Yes.
pag they feel na merong risk factor din, so pinapagawa din, right?
yes. Oo.
Actually,
Especially kung halimbawa may strong family history. Like,
Lahi ba yan?
Lahi, oo, lahi. Halimbawa, nagkaroon ng sakit sa puso yung father or yung mother at a younger age, less than 50 years old, less than 45 years old. Tapos may strong family history ng diabetes. As we know, kung diabetes talagang wala kang sintomas, so we screen for that also before the surgery.
And I agree with what you said, Doktora, na 35 years old is a good age na we have to be aware, and that's the time na magpa-check up na sila. But the age that we should advise is yung age kung saan, by incidence, kung saan maraming nagkakaroon ng mga heart attack. So usually, this is at the age of 50s. No, but currently nga, dahil dun sa lifestyle natin, even at the age of 40s and even 30s, nagkakaroon na ng mga heart attack or iba-ibang hypertension. So we have to make it earlier, yung screening. Especially nga, may nararamdaman na silang mga sintomas.
Pero pag meron kang di ba, pag covered ka ng yung insurance ng kumpanya mo, siguro even earlier,
Earlier,
mas
yes.
magpatingin na, di ba?
Yes, that's good.
Kasi kung minsan late na pag nagpatingin na.
Pero
wala
din
na.
na sa kanila yung annual physical exam.
Exam.
Oo.
But these are very basic lang yung
Yes,
mga
very
pinagagawa nila. Pero, di ba kasi parang kailangan din ikaw mismo, on your own, you know that even alam mo na bata ka, pero alam mo, you smoke a lot.
Yes.
You drink
Oo.
a lot. Then you
Mother
go.
and father.
And then
Parents.
your work is very stressful. So on your own, you should also think na dapat, parang ako, medyo kailangan ko na pumunta, di ba? Hindi, sila pa rin ang
Yes.
makakapagsabi sa sarili nila kung kailangan na nila or
Lalo
hindi.
na ngayon yung mga stress, yung sa work.
O like, for example, sa Clark, no?
Oo, sa
Clark
Clark.
Special Economic Zone o Clark Freeport, maraming
Yes.
executives yan.
Yes.
Mga stressful yan, di ba?
Yes,
Ng
yeah.
mga trabaho. Katapos yung mga expats.
Expats.
Yes.
Ayan dahil mga
Oo.
retired age na yan,
Morning pa lang, umiinom na.
umiinom na, umaga pa lang, di ba?
Activities.
The more that they should be aggressive
Yes,
in
tapos
having this
their
cleaning.
diet is not that good.
Their
Because
diet.
the fact that their exercise is gulp. They just
Yes,
keep on
gulp
gulping,
lang.
no? Mga
So
ano
we
ba yan?
have to be responsible on our own, di ba? The initiative should come from ourselves for us to have that will na magpa-check up.
Yes. Pero may denial palagi tayo, di ba?
May
Oo
denial
nga
eh.
po, may
Oo.
denial. It's part of
Sakit
it.
nga nila. Tapos, is it a good investment naman talaga para yung magpunta ka palagi sa doktor, nagpapa-check up? Is it worth it? O mag-antay ka na magkasakit na lang, doon ka na lang
Of course, it is a good investment. Your health is a good investment. What is a check-up yung babayaran mo during the check-up and some mga tests, especially sabi mo nga, usually we have already yung card, yung health card that will pay for it. Kasi once you have the disease already, no matter how much you pay for it, yung medication mo would be lifetime. Then what if you already have a heart attack? Then you will not be able to enjoy your life. You have to you will stay at the hospital. You cannot work anymore. So in the long run, being healthy would really be more cost effective
And better
rather
for your
than
family also,
yes.
right? Imbes na umahaba po yung productive years natin, nababawasan,
Yes.
tayo nang inaalagaan kaysa tayo nag-aalaga sa mga mahal natin sa buhay. Anyway, kung hindi kami nagkakaproblema ni Doktora sa mga kausap natin ngayon, kung wala silang mga ganang nagsasalita dito, no? Magbe-break po kami, na-overtime po kami ng konti. Pagkatapos po ng break, we will continue with this very important discussion. Babalik po kami.